Mesdames et messieurs, bonsoir. Encore une fois, bienvenue sur la MCTV Boston. Encore une fois, c'est Dralyne qui est avec aujourd'hui pour présenter des informations sur la santé qui pour nous pouvoir sur ça n'a fait avec nous. Jeudi, nous avons avec nous un gros garçon dans la communauté qui sont un neurologue, c'est Dr Anil. Moi, je viens présenter nous aujourd'hui qui vient parler nous de affaires neurologie et aussi sur cause Alzheimer qui a ravagé la population par nous et encore toute la population dans le monde. Dr Anil, welcome.
Thank you for having me.
Dr. Anil, let's introduce you to the Haitian population here. Tell them what you do, your specialty, and things like that.
Hi, my name is Anil Nair. I am a neurologist practicing in Quincy near the Furnace Brook Parkway, Exit 8. And I see patients with dementia and Alzheimer's in my office and also in Carnegie Hospital. And basically, I've been practicing in both clinical and research practices, trying to invent medications for Alzheimer's disease and also use them in clinical care to treat them usually.
Thank you. Bon, mesdames et messieurs, Dr. A brief summary of what you just told me. Dr. Anil, c'est un groupe de garçons dans la communauté qui vient pratiquer dans Quincy, qui spécialise dans Alzheimer avec dementia. Que nous connaissons qui ravage nous ici aussi, en plus nous avons grand monde parents nous tout ça qui a maladie. Donc, Dr. Anil, can you tell us more about the brain? Give us a brief description. What does it do? How does it affect daily lives and things like that?
As you know, the brain is the controlling part of the organ of the body, and essentially, it's considered to be essential for life. Without the brain, we are not alive.
Absolutely.
That's now the definition of life. And diseases of the brain is really hard as a challenge because it's also is the most difficult of all the organs to create cures for. And most of the brain diseases currently we do not have things which we can reverse fully. We only have things which we can control and modulate. And that's the biggest challenge with brain diseases.
Thank you. Donc, Dr. Anil dit nous que cerveau, question que je demande c'est qui ça cerveau et qui rôle dans corps nous. Il dit nous cerveau, c'est partie qui contrôle toute l'autre partie dans corps. Sans cerveau, c'est censé nous pas la vie. Nous censé mourir nous. Et c'est cerveau à tout qui contribue à contrôler tout l'autre fonctionnement, l'autre organe qui dans corps nous. Dr. Anil, tell us more about the disease itself, the Alzheimer's disease, things that are not reversible.
So in the brain, we all know that, or at least think that when we grow older, there is trouble with the memory. Unfortunately, that's a description. It actually may not be true because it's actually maybe a disease that causes the difficulty with worsening memory. And aging itself doesn't seem to be causing. So there is nothing like a normal aging. I mean, nothing like an abnormal cognitive abnormality without underlying disease is what we are moving towards from cultures having thought all along that older folks genuinely lose memory. Now we are thinking that that's actually a disease process which we are not recognizing.
Okay. Donc, je me pose Dr. Anil question sur cause Alzheimer. Mes amis, ça le répond moi, il dit que c'est pas un processus normal. Donc, les gens nous disent, ah, c'est grand monde, la grand monde, ça fait pas qu'à songer bagay. Ça pas normal. C'est que gon maladie en bas, qui manger cerveau, qui fait que moun commence à perdre mémoire. Donc, c'est pas pour nous prendre ça à la légère, pour nous dire, bon, c'est grand monde, la grand monde. La science trouve que c'est pas grand monde qui fait moun perdre du mémoire, c'est plutôt une maladie. Parce que, on nous prend ça comme exemple, c'est pas tout grand monde qui perd du mémoire. Okay, donc, Dr. Anil, can you please elaborate more, like in terms of the disease process?
Sure. So when we are thinking in terms of dementia, as I said, since majority of the cultures thought that the process was a usual process for aging, it took us a long time to figure out that this is not necessarily a normal state of living. So until the 1900s, the term dementia meant all psychiatric diseases. So we included schizophrenia, we included things like early onset Alzheimer's disease. We included pretty much any anxiety, depression, all those diseases that we thought of as into one term, and that was called dementia. So in the 1920s or so, that changed, and the Emil Kraepelin and a bunch of other folks, mostly from Europe, they divided these diseases into what we now consider to be different diseases: schizophrenia, and then early onset dementia, senile dementia, and then people also at that time still felt there was normal cognitive loss due to aging. Or so this state of affairs continued until the 60s and 70s when we got CT scans, and then a lot of those things which were thought to be related to psychiatric problems were thought to be related to vascular dementia. And once we got more information from pathology that this is due to a plaque and tangle, in the 70s and 80s, we defined those to be more in terms of pathologic disease, most of which was Alzheimer's type, and then we divided into early onset and late on. Now we are further refining that based on much older folks who are more than 75 or 80. They may have a different type of dementia other than Alzheimer's, and Alzheimer's may be in the 55 to 75 range, and the people who get it less than 65, the 55 to 65-year-olds who get disease might have a different genetic type disease. So it's actually evolving as a process, but it's both age-related and pathology-related, and we are getting better at classifying the disease than what we used to before.
Thank you. Dr. Ami, rappelez-nous que maladie que nous connaissons, nous les dementia, dans l'année 1900, c'était une maladie qui prend toute l'autre maladie qui a un problème, qui a un problème mental, maladie mentale, qui mettait dans seul panier, qui a toute dementia. Comme la science développée, il y a un test qui vient là, qui peut détecter toute l'autre maladie. Yo vient voir que ce n'est pas une seule maladie qui dit que toute l'autre maladie c'est dementia. Yo vient qu'on y catégoriser toute maladie dans côté supposé et qu'on y chercher traitement pour être traiter plus bien. Qu'on y là nous vient connaître qui bon maladie est à quand comme science évoluer, yo vient apprendre traiter maladie plus bien. Quand il y a différents types de Alzheimer, il y a des gens qui font Alzheimer puis bonheur dans 50 ans à 70 ans, il y a l'autre type, il y a l'autre type qui fait plus tard, mais il dit que maladie a un processus d'âge qui là-dedans, mais aussi un processus de pathologie qui est ajouté là-dedans, mais ce n'est pas seulement l'âge là qui fait mon avoir des problèmes. Donc, Dr. Amir, let's talk about more treatment, what to do and what are the resources, things like that.
So in the last 5 to 10 years, or even actually the last 15 years, if you say, from 2000 onwards, the diagnostic ability to define the disease has become a lot better. Okay? So we are in the process of improving their ability to define the disease better to develop treatment. So currently the treatments that we have are not really curative. We cannot cure the disease or even slow it down. We only have agents which will keep the memory where it is and make it slower to get worse with time. But we don't have anything to bring back the memory that you lost. And that is the biggest challenge that we are facing with treatment, which is actually defining the diagnosis better.
Just, exactly. So, encore une fois, la parler de maladie, il dit nous que les gens fin perdu mémoire là, pas gon médicament vraiment connait qui ka fait mon rattraper toute ça le perdu. Médicament que connait ka potentiellement ralenti et perte de mémoire là et aussi ouais se traquer mémoire là dans niveau que lié connait pour ne pas perdre plus. Mais j'en cerveau en vient dégénérer avec maladie ça yo, pas gon vraiment un protocole, on sort de ligne de médicaments qui a fait que mon rattraper mémoire li pour qu'on y ait. We'll continue with the discussion as far as treatment, like what else is available on the market.
So currently there are 2 agents available in the market, 2 classes of agents available in the market. One of them is called acetylcholinesterase inhibitors, and there are 4 drugs in that group, of which the earliest one that was approved was something called Dralyne, and then there was another one called donepezil or Aricept, and one more called Exelon and galantamine. So there is Exelon is also called rivastigmine. Okay? So these were the 4 FDA approved classes, but the first one that I talked about was quite liver toxic, so that was actually not being widely used because it causes about 20% chance of liver issues. The other ones do not seem to have that much toxicity, and they are very widely used, and patients with mild, moderate, and severe stage, all of them can quite safely and effectively use the other 3 medications. Unfortunately, they do not reverse the disease. They only keep you where you are for a period of somewhere between 1 year to 3 years, depending on how fast your disease progresses.
Okay. Et ça nous parle trop de chimie. on nous dit que Jean docteur expliqué nous il y a 4 médicaments qu'on a qui sont market là que Food and Drug Administration a approuvé pour traitement maladie hein? Mais ça qui plus puis bon yo c'est premier li même li pas vraiment un bon profil parce que li détruit foie moun mais l'autre yo edo kembe mémoire côté li à niveau que li pour 1 an ou 3 ans mais yo pas vraiment guéri maladie j'en nous penser.
So in addition to that class there is another class of medication. Those are actually something called NMDA receptor blockers, of which the FDA approved medication is something called memantine. It also comes up as Nemenda or Nemzaric. Those are the trade names for that. And this medication works in a later stage. So when you are in moderate or severe stage of the disease, it doesn't work as well in the mild stage. Then we add this one to the first class, and we can probably push that duration from 1 to 3 years by another year. So it might become 4 to 7 years if you're lucky.
Okay.
And that's really the duration of time where we can actually keep the memory from decline.
Okay. Donc, il y a encore deux autres groupes médicaments qui ont l'autre groupe médicament qui ajouté dans ça yote ba nou avant yo qui aide mémoire là durer plus. Rete côté lien, ça que pas dégénérer mais fait plus temps dans niveau ça, plus que 5 à 7 ans comme ça. Donc, on nous parle en termes de génétique. Qui ça qui fait maladie? I'm sorry. On a parlé à docteur en génétique. Qui ça qui fait maladie? Vini janvier. Est-ce que il y a un facteur dans commune, dans famille moun qui fait moun gen plus rattraper maladie ça plus vite? So, genetically speaking, is Alzheimer's disease a genetic disease? Can you get it if your family has it? Or is it just something at random like any other disease that you do with lifestyle and stuff?
Un peu comprendre.
Un peu comprendre. Ah, donc on va aller français, oui là.
But genetic is a very complicated discussion related to Alzheimer's disease.
Absolutely.
So because there are two sets of diseases really. One is a autosomal dominant disease, which is very highly. So if you have that dominant type of disease, you get the disease much earlier. You'll get it, as I said, before 60 years typically, definitely before 65 years, you know, and you can get it as young as in your late 40s. And some people, most people get that disease type in their 50s. And it's a pretty aggressive form of the disease. It progresses more rapidly. People get to a stage where they have trouble with activities of daily living within a much shorter period of time than patients who are older than 60 who develop the disease too. That kind of a genetic disease is fully penetrant, which means that many times you have a 50% chance of getting that one. Thankfully, that group is less common. It's only 2% if you take the entire disorder. So it's only a small fraction of the total amount. So it's only 1 in 50 of the total number of times you have Alzheimer's disease that you have a genetic one which is heritable to the children so much. The more common type of Alzheimer's is a less genetically transmissible ones because it's multiple genes involved in the production of the disease, not just one gene. Typically more than 6 genes are involved. Which may mean that the amount of risk that you transmit to the next generation is much lower. So it's usually in the 6% chance in the general population. But it might become, if you have a family history, that might increase to 10% or so.
Okay.
But there are multiple other factors involved in that. So if you have, so the person, so men have a little bit higher risk than women to get the disease actually because it also occurs earlier. If you're a woman, you have a less risk of getting that. But women also tend to live longer than men. Therefore, the total amount of women who actually have the disease might still be slightly more than men. It's not a really clear, direct answer for that.
Right.
Race is a big factor in the genetics. Having an African American ancestry, unfortunately, increases your risk of getting the disease of Alzheimer's disease. So those are the two major modifying factors as far as the genetic risk is concerned. So it's the gender and race really is the primary modulators of genetic risk.
Donc, comme médecin so dit là, génétiquement parlant, maladie a deux facettes. si c'est une maladie qui domine dans jeune femme ou gagne 50% chance comme ça que ou ka gagner mais en pif yo jeune que ça c'est seulement une petite portion de la population gagne plus monde qui gagne yo sont paquet de facteurs qui mettent ensemble c'est une série de gènes qui mettent ensemble qui fait qu'on gagne et gagne plus monde comme ça qui gagne maladie mais fille yo que gagne plus filles qui gagne maladie mais garçons plus à risque pour gagner maladie. C'est que c'est pour ça que fait plus filles qui maladie parce que filles vivent plus longtemps que garçons. Donc garçons qui étaient pour maladie yo allé déjà à l'autre bord de l'eau, mesdames yo étaient la même maladie que dirait puis plus longtemps dans yo. On l'autre facette encore c'est que sous son monde qui noir comme yo dit qui African American descent que nous même qui sorti à Haïti comme ça, nous gain plus risque pour nous gagner maladie. Qui sont l'autre raison que me poser c'est l'autre question que me poser docteur Amir qui gens pour moun tester pour être sous risque pour maladie parce que Jean bagala et là gain les bagala c'est sur nous la venir plus. Dr. Amir, can you just tell us about testing? Like what can one do in the younger age to find out whether you're at risk for the disease?
There are many types of ways of testing for the disease. We are struggling with identifying before, so we know that the underlying process from the recent scans goes for many years before the disease actually presents. Okay, so so the essential thing about the disease is it's been defined in terms of two entities. One of them is a abnormal brain plaque called amyloid plaque, and the other one is that of a abnormal intraneuronal inside the neuron problem called tangle. That's caused by another protein called tau. So these two things kind of interact together to create the effect of Alzheimer's disease, causing death of the neuron and then eventually causing memory loss. But that's a slow process. It's not a fast process. It goes on over maybe 30, 40 years. And that's really the primary difficulty that we face with diagnosis, is that there's a large amount of the population who may be in the preclinical stage, but they're not symptomatic, and we have in the past when we were trying to identify people or for clinical trials or for studying them have misclassified them and taken deceased but carrier state or preclinical disease folks and thought that they were actually not having this disease. So diagnosis is hard in this case. Recently, in 2012, 3 scans were approved for testing the brain for presence of the plaque. So now we can tell with a 92% specificity and 98% sensitivity that if you have abnormal amyloid in the brain, we can show that on a picture, and we are right about 90% of the time. You know. However, what we discovered when we looked at that group of people is that our previous way of diagnosing that was using memory tests, we were wrong about 30% of the time. Okay. So we were wrong either way. We either classified someone who did not. So think about a high school. There are students who get A's and B's and C's. So and if you're giving a test which most people with a B would pass, some of the C students might end up having dementia. Yeah. And some of the A students may have to really become much worse before we can diagnose them. That's the same idea where we are actually misclassifying. So it's not that we are making a mistake. We just, because of the social, economic, and educational constants that is part of life in society, people don't have the same, so when you look at most of the things in our studies, zip code means a lot more than race. The only thing linked to zip code really is education. So the early childhood education seems to be a factor related to this problem either. I'm assuming that everybody is the same, intellectually and otherwise. So lack of opportunities seem to eventually affect our ability to diagnose people correctly.
I see.
So that's a big trouble that we see with diagnosis. So memory test is one way of diagnosing. Scans are another way of diagnosing. The genetics cannot diagnose the disease, can only tell you the risk.
Okay. Donc, Jean-Docteur a tout expliqué là, en plus là, nous qui parlons anglais, qui bien comprendre, mais moi-même, m'a fait tout possible pour récupérer, rattraper tout ça dit essentiel dans ça le dit. Il dit que lors commence une maladie, quand vous demandez est-ce que un test génétique qui a testé pour lui. Il dit génétique qui a dit sur un risque, mais il pas vraiment fait diagnostic pour dire oui ou bien ou non pas gagner. En pile fois ça rejoint un monde qui fait maladie ça, c'est des plaques qui dans cerveau ou du moins des substances qui en dedans cellules qui dans cerveau en combination qui fait moun nan vin cellule nan vin mourir, qui fait moun nan fait maladie qui relè Alzheimer. Kon yon sa ou fait des tests pour ouais qui est-ce qui pi à risque, qui groupe moun qui pi à risque et tout ça, mais test ça et pas toutefois que yo te positif ou du moins que yo te gen pile que te vraiment et comme tu as dit ça solide en termes de accuracy j'en moun yo dit mais ça yo connait gen différentes façons pour yo faire. Yo fait scan nan, yo garder cerveau pour essayer gen des plaques, yo fait test là et puis aussi yo garder l'autre facteur socio-économique et qui j'en moun nan nan année d'avant yo qui j'en levé, éducation tout ça qui met un paquet de facteurs ensemble qui fait pour yo dire OK qui ça qui te cause maladie ça avec qui ça qui pas cause li. Donc c'est pas un seul facteur qui fait maladie gon paquet de bagay qui en jeu, le médecin a essayé de déterminer qui jonte commencé avec maladie. Mais ça pas veut dire que nous pas préalablement testo ou du moins essayer ouais si gen des bagay qui ka metto à risque pour gen maladie, mais test ça pas vraiment dire si ou gen maladie ou pas gen maladie.
Thank you.
You're welcome.
I'm also trying to understand you. My French is very weak.
Oh, no problem. We'll talk about more French later. Mais pas oublier, docteur ka comprendre nous, si nous allons office li, tout ça, il ka toujours faire toute façon pour laisser comprendre nous. Like I said, you will try to understand them if they are from the Haitian descent. Sure. You'll do your best to understand.
So maybe we should also talk about how the Haitian dementia in Haiti.
Absolutely.
I may be able to talk a few words about that. You know, Haiti is really one of the poorest countries in the Americas, if you look at all of them. And so, like compared to United States, the current life expectancy for Haitian Americans, I mean, not Haitian Americans, Haitians living in Haiti, is about 59 years for males and 62 years for females. Okay, and it's estimated that 800,000 Haitians are over 60 years of age. Okay, so that's a population who is actually at risk for dementia in that country. And with the 10-year history of earthquake, a lot of them are actually displaced, are in a situation where they cannot really be diagnosed without the facility. There's nobody to diagnose.
Right.
You know, and this is so it's really difficult. There was a polyclinic in Haiti who actually tried to understand the prevalence of the disease. We really don't have data at this point about the actual prevalence of dementia in Haiti, and definitely there's no data on scan data, so that it's literally not present in Haiti. Whereas in the population who are coming here, they do get good care because they are able to see and diagnose patients. I mean, able to see doctors and nurse practitioners and PAs enough to get diagnosed earlier. So the lack of diagnosis really seems to be the biggest problem
in the
Haiti.
country.
Yeah.
Okay. So, Jean-Docteur Asodien t'a parlé de Alzheimer dans pays haïtien directement. J'en suis expliqué, c'est que Haïti, genre tout le monde a dit c'est pays qui est pauvre. Moi, je ne suis pas de cet avis parce que je connais pays riche, belle, bien belle. OK? Donc, c'est ça, on mettait dans le papier, donc c'est ça, métier en dit. Mais ça tout contribue dans cause maladie oui mais ça j'en contribue c'est que Haïti pas gon gens vraiment pour calculer combien monde qui gen maladie parce que pas vraiment gon clinique qui vient dire qui pour prendre des informations pour ta compiler gens fait ici mais l'elle vient parler de haïtien qui vient ici au connait il dit que il vient joindre bon soin il joindre médecin il joindre nurse practitioner il joindre physician assistant qui prend soin au puis bien qu'on y a gon plus il ka juste prendre information pour ouais qui est-ce qui gagne qui est-ce qui pas gagne mais en termes de manger qu'on y a qui nous parler avec médecin qui ça moun yo ka fait qui ça yo ka manger qui nourriture que yo ka prend pour ouais que te ka aider combattre maladie. Dr. Anil, is there any dietary restrictions or the addition that the Haitian population can do to help them combat or prevent the disease?
Excellent question. So that's definitely one of the things that I've actually done several clinical trials in the past. So the one of you may have heard about Mediterranean diet. That's a thing that one of my friends from Colombia originally had a thesis on. And so according to what he wrote in a chapter of a book that I wrote, the the dietary modifications are quite valuable in preventing dementia if combined with exercise. Okay, so both are important. So dietary factors that actually help seems to be unprocessed. So if you process food too much or in any way, you are actually reducing the ability of the food products to be helpful to prevent dementia.
Right.
So for example, fish oil. Fish helps in preventing dementia. So we try to take out the fish oil from the fish
in the capsule.
and put it in the capsule and give it to the patient. Did not work.
Yeah.
Similarly, vitamin E, which is actually foods containing higher amount of vitamin E helps prevent dementia. But when we took out vitamin E, gave large amounts of that to patients at risk for dementia, that did not work either. So processing seems to not really help, but foods which are higher in green foods, which are higher in vegetables, less red meat, more white meat, and fish seems to be helpful in population level to prevent dementia. However, when we try to take those interventions and give it to prevent as a treatment fashion in a randomized studies, none of them actually panned out. But it might be a factor of us processing the food. We genuinely do not know why the healthy population level things did not translate into food activity. I mean, into this. So this is food. We'll talk about exercise. Maybe you can translate.
Of course. Ça c'est Dr Anil so dit nous là, c'est bagage qui très important pour non seulement pour nous mêmes haïtiens qui vivent ici, mais aussi pour tout l'autre monde. Li parler de le manger en passion sorte de procès comme manger dans boîte, manger qui nan bagay qui frozen bagay comme ça, yo vinn gen moins valeur nutritive qui te ka aider nous combattre progression maladie. Par exemple, il dit que vitamine I son bagay qui aide à maladie qui prévient maladie, mais là nous retirer vitamine I à nous mettre dans pilule, li pa gen même effet que si c'était dans poisson nous te joindre ou bien dans manger naturel. Aussi tout parler de manger de végétaux bagay comme ça, mais il dit que sans manger avec valeur exercice ou fait, c'est ça qui aide combattre maladie en général. Donc si n'a prend manger n'a pas acheter bagay qui dans boîte plutôt lieu que n'acheter bagay qui naturel que nous habitués manger la caille. Là nous venons ici nous éclairer n'a prend bagay qui dans boîte plutôt, il va gagner plus valeur que ça qui nous râler sorti dans terre. Donc on mange un patate bouilli ou du moins sou prend 2-3 feuilles épinards ou fricassé au fond manger, il gagne plus valeur nutritive pour manger avec un morceau poisson frais que si on aller ou prendre des morceaux de bœuf qui dans boîte, l'autre bagay comme ça qui déjà frise qui perd toute valeur nutritive. Donc ça c'est bagay pour nous kembe dans l'esprit nous comme on connaît quand nous évolue en culture nous changer ça nous manger. Quand nous allons parler de exercice. Now tell us more about exercise.
Yeah. So exercise as you know is always a good thing generally unless you do it to the extreme. And that's exactly what so moderate amount of exercise is quite beneficial in preventing dementia. So again, in the previous book that I wrote, there was a chapter on exercise, and in that, Laura Baker from Wake Forest University, she gave folks exercise in a randomized fashion. So there were over 140 subjects who got an exercise intervention of walking 45 minutes to an hour a day, or a small chair yoga, like not very active exercise, or a health pamphlet. And compared to the folks who got the health pamphlet, the folks with the exercise increase the size of the hippocampal structures. That's the memory structures in the brain, a real increase in size in a statistically significant fashion. So it does help you maintain your brain.
Right,
yeah.
In terms of exercise. So, Dr Anil dit nous comme ça, fait exercice petit programme qui pas tellement comme si bagay qui excessif non tant comme on lever faire gros bagay ça yo mais petit programme exercice 30 à 45 minutes par jour aider l'esprit spécialement section mémoire là développer plus vite ou rester actif que monde qui pas fait des exercices du tout. Lycée monde qui écrit des gros livres avec 100 000 côté que yo te fait des recherches, yo te collecté des informations qui te dit côté que moun yo ba un pamphlet pour exercice avec moun qui fait exercice là, ou gens moun qui fait exercice excessif yo, moun qui te fait exercice là trouver que son monde qui mémoire était plus actif et puis dans cerveau qui est responsable cause mémoire là devient plus développé que l'autre monde qui pas fait exercice du tout.
Other thing I wanted to reinforce everyone is that going to physicians regularly to treat blood pressure, diabetes especially, because Alzheimer's is thought of to be type 3 diabetes, very similar to diabetes. and also controlling your medication list and taking them regularly, and not missing medications which are meant for hypertension or diabetes or even dementia, but taking them regularly and ensuring that the parent or the mom or dad or grandparent or granddad has the ability to remind them to take the medication correctly will be a great help. Family members can be more involved in the care would also be a great help.
Right. So, mes amis, ça me dit là pour ti jan choqué nous parce que médecins sont référés à dementia comme diabète type 3. Donc, moun qui parle qu'à médecin ou leur supposé aller, pas prendre médicament leur supposé prendre, il paraît que nous plus à risque pour nous développer maladie. Moun qui fait attention, il dit faut nous prendre médicament nous à l'heure, j'en nous supposé prendre. Moun qui fait diabète, même bagay là, et puis il dit gon question de famille qui vous ta vinn prendre en main, aider tout le monde ça. Si vous grand moun yo tout, aider prendre médicament à l'heure, aider faire supposé faire à l'heure. Sinon n'a vinn développer maladie ça et sommeil qui développer tical partical c'est le elle vinn trop tard venir réaliser qu'on gagne donc il a préférable pour depuis qu'on y est faire visite chez docteur nous chaque année ou moins chaque 6 mois chaque 3 mois gens que ordonner nous pour nous ta faire et puis tout checker mais assurer nous que nous prend médicament nous gens nous supposé faire. You're welcome. Dr. Amir, besides exercise, diet, is there anything else that people can do? So
there have been memory training programs that a lot of them are on the internet. However, compared to the exercise or anything, it's reading or doing mnemonic strategies, things like that do help. So if you are putting in terms of effectiveness, of size of effectiveness, so if you do the memory tests, memory challenges, it's actually better to do that by a factor of 2, I would say. Whereas the exercise would be by a factor of 5. This is my opinion.
Right.
And whereas taking the correct dietary amount would be somewhere in between that. And taking the medications which are approved by the FDA is probably a factor of double that, double this, so 10 times better, to be honest.
Okay.
But however, all these things can always be combined, and we are hoping that this will be a better thing to do then.
Absolutely. So, Dr. Anil encore rappelez nous que le nous a fait petit exercice, pas seulement exercice dans le corps, mais aussi pour le cerveau. Donc, pour nous lire de temps en temps, faire des petits programmes mathématiques, faire des petites multiplications rapides, des trucs comme ça. Tout ça aide à descendre risque nous pour nous gagner maladie. Mais aussi, l'on mette tout facteur ensemble, si nous avons une maladie, en tant que manger, faire exercice, et puis ensuite faire des petits programmes ça yo. Tout ça a aidé ensemble avec prendre médicaments que FDA a approuvé pour maladie. Tout ça a aidé nous. Quand on a dit ça fait un effet multiplicateur sous aider maladie à pas progresser.
I also think that there's a role for participating in clinical trials. You know, one of the things that I notice is that when we are trying to recruit the patients for clinical trials, mostly because of the language difficulties, sometimes we are not getting as many persons of color to join the clinical trials. That'll be a very welcome thing if people actually volunteered to help us find a cure for this.
Right, but I could say also in their defense, historically,
yes,
people of color were not exactly.
So, but that's like hopefully, you know, that is something which we have now overcome. We are checking. We are doing several degrees of checks and balances to make sure that nothing bad happens.
Absolutely.
But I also think that it can be encouraged in the community to take part.
Of course.
And it's time we moved past that. I'm hoping that it's a free and equal world.
I agree. I just wanted to go back and say, hey, I understand their fear. Donc, Dr. Anil so dit nous, li trouve que là fait des recherches sur maladie, pas grand pile monde tant que nous comme haïtiens qui participer dans recherche. Moi dit moi-même penser que c'est parce que nous peur pour pas traiter nous également avec l'autre monde que ba nous bagay que nous pas supposé prendre. Mais li dit que ba yo changer konye, gen pile et check qui fait sous bagay yo pour empêcher que bagay qui était qu'on fait longtemps yo pas arriver encore. C'est li leur arriver pour nous grandir quand moun yo dit pour nous pas penser que moun a fait nous mais au fait participer pour nous aider l'autre génération du moins moun qui vient après nous yo jeune plus bon résultat en termes de traitement tout ça. Dr. Anil, any last word, anything else you'd like to share with us?
So I really hope that the increase in awareness about this bad disease is actually really helpful to everybody in the community. And I thank you for having me.
Absolutely. Encore, c'est un plaisir pour nous te gen Dr. Anil. Ça li vle, c'est que pour tout le monde ta vin gen plus connaissance sur maladie, pour nous pas prendre comme nous prend la caille, tout bagay c'est tabou, moun fou c'est tabou, pour nous pas penser que c'est moun ka fait non, en pile fois les moun nan perdi mémoire, nous penser que c'est moun qui vont bagay sou li. Pour nous ta vin connaître que des fois c'est al kay médecin, chercher traitement, chercher ça nous gagner, chercher connaître plus connaissance sur ça nous gagner, pour ça n'a gen plus traitement, n'a gen plus Jean Blanc qu'on dit, puis bon outcome, avenir plus belle. Mais docteur là, il là dans coin dit va là pour lui ouais nous si nous besoin faire des tests pareil comme ça ou du moins si nous avons famille qui maladie tout qui besoin de traitement nous ta mon côté pour lui joindre soin nous ca toujours aller ouais docteur Anil mais comme traitement au jour le jour yo tant que traitement nous chaque année docteur Bonnet là comme médecin en communauté qui là qui fait des références pour nous si nous c'est pas un docteur Bonnet tout ça donc lui souhaiter pour nous tout bon bagay qui gagne mais aussi pour nous toujours nous réveiller éduquer tête nous chercher information pour nous qui ça tout bagay pas juste penser que son monde qui faut bien son bagay qui arrive son l'autre bagay mais toujours penser que ka gon raison pour ça gagne et docteur bien content que dans le programme avec nous aujourd'hui we thank you so much for educating us for giving us a piece of your brain so to say I hope that we have you again on the program maybe for more another subject or things like that, and the population will be more than happy to see you again.
Thank you so much.
Absolutely, thank you. Mesdames et messieurs, au revoir. C'est un plaisir encore que vous êtes avec nous encore une fois sur l'écran MCTV Boston. Encore une fois, à la prochaine.